Hello there. Welcome to another episode of Coffee and Audiology. My name is Dan Hewson, and I want to thank you for joining us today. And I have so many things I want to share and so many ideas and thoughts for people that have issues with their hearing, with balance, with their memory, with tinnitus. And the focus of Coffee and Audiology is first and foremost to make sure that you have coffee. And I love this one. This cup says, "This coffee is very strong." So I really love the purpose of coffee. And so today I'm actually drinking a Caribou blend. I'm not sure if we can see that. Caribou blend is what I'm having. Cheers to you today for joining me in Coffee and Audiology and, for allowing me to have the opportunity to be able to kind of answer questions that people have. And that's the purpose of the show, is to have people come on board and ask questions, people that wear hearing aids or people that have hearing loss or suspected hearing loss or family members or anything that's related to the ears. I have been practicing for 25 years. I've also worn hearing aids for 43 years. So I was born with a congenital hearing loss. I started wearing hearing aids when I was 4 years old. So it was a very different time. It was back in the 70s. So I really want to take my knowledge of 25 years of practicing, 43 years of wearing them, and kind of combine all of this to bring on this show about, just helping people to be aware of what's really going on. Get yourself energy, get yourself caffeine, and let's get to the questions. So good. All right. So question number one, patient says, "I recently woke up and lost all of my hearing in the right ear. I thought it was an ear infection and went to urgent care and they treated it like an infection. Like a draining ear infection. I learned later that this was not the case and I lost all of my hearing. What should I have done differently and what do I do now? I cannot hear out of this ear." So having worked in ear, nose, and throat practice for all the years that I had, I cannot tell you how many times that I came across this. And it's really sad because individuals that have this occur to them, when they're going through this instance, when they lose their hearing, they think their ear is just plugged or there might be an ear infection. And so a lot of people end up going to an urgent care or go to the emergency room. They have no idea that something just happened to their inner ear that could be potentially devastating for the rest of their lives. You have a sudden hearing loss or sudden nerve hearing loss in your ears. That is an indication that something has badly occurred inside of the inner ear in the nerve. And so I always recommend patients to get to an audiologist, if possible, immediately, because generally speaking, as a rule of thumb of having worked for a long time in this industry, most people can get into an audiologist's office faster than they can into an ear, nose, and throat doctor's office. It can occur. So it's important to talk about, we call this in our field, sudden sensory neural hearing loss. That sometimes it's an attack to the autoimmune system of our body. Sometimes people have had small strokes, blood clots that get into the inner ear. There can be a myriad of things that occur, but unfortunately, when doctors go through, if we find that there's nothing wrong with the ear, unfortunately, the patient loses their hearing. Hindsight's 50-50. Most people don't even know this. And when I worked in ear, nose, and throat practice, I did this for 15 years. This was one of my frustrations, is simply that the patient themselves would come in 6, 7, 8 weeks after this occurred and say, "Well, can we get the wax out? Can we get a prescription for fixing my ear as far as the infection is concerned?" Problem is that after we did all of the testing, in many cases doing an MRI, we found out that there was nothing that could be done. A sudden hearing loss like that, going to audiologist, going to ENT as fast as possible, and generally speaking, the general rules of thumb kind of vary, but it's somewhere between 24 to 72 hours to get this taken care of. And a lot of times what we have to do is get patient on prednisone, and that's the prescription where it does need to come in from a doctor. However, what I've learned in my 25 years is that an audiologist can verify the actual hearing loss, and they can also communicate with your primary care doctor if you have one, and being able to recommend the dosages and the amount and the type of steroid, that you may need to take. And that is so important. That time is of the essence, because if we wait a lot longer than that, unfortunately, the likelihood of restoring your hearing back to where it was is dramatically reduced. The last part of this question is, can I hear out of this ear? What do I do? So there's really there's two major scenarios where an audiology practice can really focus on with hearing in this particular case. Now, what we don't know in this individual's particular circumstance, number one, is do they have normal hearing in the good ear, which in this case was the left ear. They lost their hearing in their right ear. If their hearing is normal, then the patient has to make a deciding factor of what occurs for their hearing, because a lot of times it's very misunderstood, because well, I can still hear here, this one is not working any further. So basically their thought process is, I'm fine, I can hear good. But if you think about it, you just lost, you're basically deaf in that case, or very severely limited in your hearing ability on that right side. So that individual's now lost a tremendous amount of localization and directionality. So the focus ends up being is, we really need to get them in, get a test done, being able to determine if we put a device in this ear, it is a hearing aid, and a hearing aid in this ear, what that is called a cross, CROS, and that stands for contralateral routing of the signal, which essentially allows us with a device in this ear, basically sending signals back and forth between the dead ear and the good ear, and allows us to transmit information with a microphone on this side so that we can hear from this side, so that we have the localization and directionality back. Even though you may have more normal or very borderline hearing ability in that ear, the point ends up being is that with this cross system, it allows the person to be able to hear from both ears. And it works magically, and today's technology has come so far from what it was 25 years ago. Now, the flip side of it for those individuals this occurs to is using a bicross. Bicross now is obviously the same setup, except this ear needs amplification. So this means that the person has hearing loss, they need hearing aids, and so we put an actual hearing aid that amplifies sound in this ear, where a cross does not amplify sound. It's just transmitting the sound so that the brain gets the information from both ears. The bicross allows you to have amplification to fix the left ear for whatever hearing loss may be in there, and giving that directionality and localization coming from the bad ear. So when you're looking at a situation as very unfortunate as this is concerned, there is a great alternative to using either a cross or a bicross to be able to help in that situation. But I go back to what I said at the beginning, time is of the essence. The sooner we do something with this, the better. And it gives us that greater ability to be able to help people and to make them aware of these things by doing these types of talk shows so that people can become aware of the issues that are occurring. So to the individual, I'm really sorry that this occurred, because obviously it's a life changer. It's a very emotional, and you lose all of your hearing in that ear. I'll give you a little story. When I was about 34 years old, I was playing basketball and I got hit in this side of the head and lost all of my hearing in this ear. So when that occurred, I had tinnitus, ringing in the ears. It was unbelievable. I could not believe how loud it was. And so when I hear stories about what this patient is talking about, it really brings it home to me, because I experienced this. And so inadvertently, it's just playing basketball. Nothing major happened. But what I actually had was what was called a cochlear concussion. Basically, it got hit here, right back here behind the ear on the mastoid bone. And it crossed over and I lost all of my hearing over here. So they did exploratory surgery the very next morning to be able to see if I didn't have some kind of crack in the inner ear wall, leaking fluid inside. And it turned out that I did not. So fortunately, they put me on prednisone. I did this all immediately, and I got most of the hearing back. Now keep in mind, I've worn hearing aids again since I was 4 years old. So this was my better ear. So even though it didn't all come back, I'm able to use the phone. I can still hear in that ear if need be. But the point is that I lost a lot of it. So there are a lot of incidences that occur. Having worked in ear, nose, and throat, I can really relate to people in that regards. And that's really kind of why this question is kind of near and dear to me, that I was able to get a dramatic improvement in my situation because I addressed it sooner than later. So for the individual that this occurred to, and for the many people that this does occur to, because, it's amazing, we see this all the time. And all the purposes and the reasons why this occurred, we don't always know. But what we do know is that if you can get in immediately to get it resolved, that is step number one. And step number two, if the outcome comes about that we need amplification or help with that, we have a lot of great options to be able to help the individuals in that regards. So let's go on to question number 2. First, take another cup of coffee, drink in my coffee. I have worn hearing aids for 20 years and have tried different hearing aids, and I am so frustrated as I have worn Phonak, Oticon, Widex, and Costco hearing aids, and I am still not hearing well. Is there any hope? So first, let me go back and talk about this individual and what they're saying, that they have hearing aids for 20 years and they've tried many different types of hearing aids. It's very important to understand that all manufacturers really make great hearing aids. It's kind of like saying a brand new car is no good, or it's not the car I really wanted, but it can still get you from here to there. Hearing is very different. People in our general field do not understand actually what we do. A hearing aid is a lot more than just something that makes things louder and softer. Hearing aid does more in terms of how the brain is working. The medical aspect, hearing loss is a medical condition. Something has happened not only just to the inner ear, but it's also affected the way the brain is working. Hearing aids can only do so much. That's why people buy a lot of hearing aids online today, because they don't think that it's any different than going to an audiology office and spending thousands of dollars on what we do to help people. They think it's all the same. And so when we do programming with the hearing aids on and doing this Wheeler measurement and the sound field testing with the hearing aids on, those are the things that helps us to really verify how a person's actually doing. So in this particular case, somebody struggled with hearing aids for so long. It's unfortunate because they need to get all of this testing done. I will tell you that depending upon the severity of the hearing loss, and of course the origination of the hearing loss, has somebody been having hearing issues for 20 years and they've never done well with hearing aids, there's a lot of people that are like that. Is there hope? And I will tell you there is, and verify how somebody is hearing in background noise using what's called Hewson, which is a test that is very seldomly used in our industry to be able to verify how well that person can hear in background noise. That, to me, this is, and in our practice, it's crucial and very critical to verify that information for the person to know exactly how they're doing when they're in a group situation. Think about this. If I'm talking to that individual and I ask them, what is your number one biggest concern with your hearing loss? What issues are you having with your hearing aids? You know what his number one answer will probably be? I can't hear in background noise. And so we need to verify that individual without their hearing aids on to verify how they're hearing in noise, and then being able to test the person in background noise. We do a basic cleaning check and ask how the patient is just doing. Unfortunately, it's not really giving you as the patient that crucial, critical care of staying on top of the hearing loss. So it opens the door, essentially, of potentially having more issues with your hearing and understanding of speech. Again, I go back to looking at patients when they come in, what kind of testing did you have done? It doesn't matter, again, where you get hearing aids from, but as long as those best practices are done in regards to doing the verification testing. It's very important to understand what got us here in the first place. So looking at the individual's hearing loss and being able to recognize where the biggest problems are with that hearing loss, and then being able to recommend that technology. So one thing with all of this is you talk about manufacturers, but manufacturers have different levels of technology. So that's really important, that we can blame the manufacturer, we can blame the provider, we can blame all these things. But there again, it is important that we as a patient have the wherewithal to know that my hearing aids need to be for what my hearing loss needs as opposed to what I want. But at the end of the day, I'm like, look, my number one concern is your ability to understand words, clarity, background noise, restaurants, different things like that, so you can understand, especially in the era today when we're wearing these things. Masks, they're wonderful. However, they're very difficult when you're trying to be able to hear someone and you're hearing impaired. And that's why, is there hope for people? Yes, but you need to ask the right questions. Where you're going, do they do testing to verify my hearing abilities with the hearing aids on? Do they do any follow-ups? Are they consistent about that? How do I know where I'm going? Where was I before, when I had my hearing loss, which is easy to determine, but where am I at with the hearing aids on? How much progress have I made? And what should my realistic expectations be with those hearing aids on? Because at the end of the day, if this person or anybody out there that keeps going through this kind of situation, you're going to be extremely frustrated. You pay less money for something. Sometimes individuals really believe it's better. And I have to say that it's part of it is our field's fault, our practice's fault, that we really need to pay attention to detail. But I will also say part of it is that we just need to work together to be able to come through with the answers to the problems that people are having. That one thing that people misunderstand about our industry is they think hearing aids are basically volume controls, up and down. I had a gentleman the other day came in and he said, "That's all you do." I said, "Okay, that's not true." I said, if that's all you think we do, then I said, "Go ahead and get an amplifier." He said, "Well, I've already done that." He said, "It was terrible." And I said, "Right, because you didn't actually have a hearing aid." Okay, I never allow a patient to give up hope. And I want you to know that there's hope indeed for you out there, those that are having difficulties with your hearing loss. But we need to dissect that case history. We need to go through your hearing loss. We need to go through your programming. And that's one of the things that I'm happy to discuss with you, being able to help with you, even if it's individually, even if it's one-on-one, to help with that, because this is critical. Because I've seen people come in with 5, 6 sets of hearing aids. I got to tell you, this should never happen, ever. And so I know I speak with many of my fellow providers out there that work so hard in trying to explain and educate people. But there's always two sides to the story. And so for those individuals that have had this kind of an issue, please remember there is great hope, but you need to work with a provider that's going to focus on the right technology and explain to you why they're using that technology. I've had patients who just quit. They just quit trying anymore. They quit trying to hear. And sadly, that's going to lead to greater medical conditions, leading to potential issues with memory loss, balance issues, and there's no reason for it. We just have to work together to figure out what it is that you need to help your problem. I hope that answers that question. Okay, question number 3. I always develop a lot of wax in my ears and have tried flushing them out and get different gadgets to clean my ears with, and I still have difficulties. What would you recommend is the best way to take care of the wax? So I started cleaning out ears when I was working in an ear, nose, and throat practice probably about 15 years ago. And I would see so many people try so many different things. There's so many things on the market about this. I can't even tell you. It's just, it's amazing. Then there's going to be a lot of you out there that have done this as well. You got the new tools that they use with it looks like a little reamer inside that you go in there and just basically like a cork go in there and try to pull it out. There's people that use Q-tips is a huge factor. There's people that use bobby pins. There's people that use just about, they're long. I've had one patient, they have fingernails and one finger, it was extremely long just to go in there and scoop it out. But people will stick things in their ears and they have no idea what's going on. So when I worked in ear, nose, and throat practice, I would see tremendous amounts of people that had issues with their ears because they went in there and scooped it out. They went in there and scraped it out, and they actually caused injury to their ears, and they could never get that back. And so what I must say to you is, and I'm talking injuries, I'm talking about perforations of the eardrum, bleeding. First things about your ears is to understand some of the skin inside of your ear canal is some of the most sensitive skin in your body. And so when we go inside of there and start digging around, when we look in the ears, we can always tell somebody's has cleaned out their ears with Q-tips or some other kind of device because the blood vessels in the canal get tremendously irritated. And so it's important to take the time to explain to patients about getting the wax out of your ears. There's people we recommend using olive oil. Olive oil really works really well. It doesn't matter if it's extra virgin olive oil, regular olive oil. But what that does that's really well is by going in there, letting it sit inside of there, and it helps to loosen up any wax that's in there. And it also works really well with the skin. So I'm out in the West here in Arizona, and it's important to remember that it's extremely dry out here. So a lot of people have a lot of dry dead skin in their ears too, and they don't even realize it. And in some cases, they don't even have much wax in there. It's just the skin has basically formed like a cobweb over the ear. And so we can't even see their eardrum. So it's important that the olive oil does really well at being able to get down inside of there to soften up the skin, loosen it up from the edges, kind of almost lubricates the canal essentially. So it allows it a lot easier to flush it out of their ears. Now, you have to be cautious of any time you're doing something, of anything you're putting in your ears, if you've had any history of medical issues, perforation in the ears, holes in the eardrum, a lot of a history of ear infections. Because if you have a lot of that, please don't stick anything in your ears. I don't care what it is. I don't care what devices you read about. You need to have someone who is medically trained to be able to take care of cleaning out the ears. It's just, you can cause a lot of issues, especially if there's perforations in the eardrum that can cause dizziness and a lot of other problems with the ears, with chronic infections, things like that. Just have somebody who's medically trained to take care of that. Generally, in some cases, you can do about once every 6 months to a year to go in and have it done. But a lot of cases, even our primary doctors are not even cleaning them out anymore. And there's a lot of medical reasons for that. But again, I would recommend somebody that's trained in doing this, whether it's an audiologist that's trained in doing it, or whether it is a ear, nose, and throat doctor that obviously does it. But not every audiologist does know how to clean out ears. Even though they're trained on it, they're not as maybe schooled in doing that, or maybe they just don't feel comfortable doing it. That should give you a clue as to why people should be sticking something in their ear to try to clean it out themselves, because we've seen many injuries that occur with that. Using Q-tips and sticking them down inside. Q-tips in a lot of cases are about the same diameter as your ear canal and pushes it in more than it gets it out. There's a lot of chemicals on Q-tips as well that can actually cause it to dry out the ear canal. So it's really, really important to be able to be aware of what it is that you're putting into your ears. Bobby pins, fingernails. I've seen screwdrivers. People make their own concoctions of going in there and pulling wax out. You got to remember that you got a lot of tools in there. I've had chronic, massive, it's called otitis externa, which is basically an outer ear, ear infection, drainage coming out, big green blood drainage coming out because people try to take care of this themselves. So anyway, the old expression is don't stick anything bigger than your elbow in there. So try to remember that, because it's such an easy thing to take care of. But I would always recommend, especially in cases that people have a lot of issues with their ears, is to just go in and get it taken care of and stay on top of your hearing. It's very important to get your hearing tested once a year, kind of verify if anything's going on with the way that you hear. And even if you think you hear fine, remember, hearing loss is not one-dimensional. It's about how the brain is working too, and how well you're able to process information. We talk about people who have brain fatigue, people who don't process things as quickly as they once did. You have people that cannot, separate the noise from the speech like they used to. They get frustrated in those types of environments. And that's part of what a hearing test can tell you, especially in background noise, exactly what that brain is able to process in that regard. So it's important to get that verified, and when you're doing testing for the ears, but make sure that you always get your ears looked at. I've had patients in the past. I remember one particular patient when I was very young in this field, that the doctor sent him over to get a hearing test. The doctor didn't look in his ears yet. It was an ear, nose, and throat doctor. And the patient came in, sat down, and we looked into his ears, and he said, okay, I just got my new hearing aids. I really love them. They make a big difference. I'm like, oh, awesome, great. Well, take your hearing aids out. Let's look in your ears. And the patient was impacted with wax. I'm not just saying a little bit of wax. I couldn't even see anywhere around inside the canal that would even remotely get any air through there. Patient said, I feel like I'm talking in a tin can. So I said to the patient, I said, how long have you felt like this? And the patient said, probably about 6 months. I said, So my next question was, well, when did you get your hearing aids? He goes, I just got them about 3 weeks ago. It's like, okay. So I just left it at that. So I said, in this particular time, I was not cleaning ears out. This was about 5 years ago. Sent the patient back. The doctor cleaned out the ears. Patient came back in, and I did a hearing test. And lo and behold, that patient's hearing was normal. And so it was like, okay. So the patient comes out of the booth, and I said, so your hearing is normal? And the patient's like, what? I said, yes, your hearing is normal. And the patient was flabbergasted and did not realize that they had normal hearing because of the way they were tested. They were sure that they needed hearing aids. So again, regardless of the outcome, it's always important to have your ears checked and your ears cleaned on a consistent basis, especially if you do wear hearing aids. There are people who will say that I never had issues with wax till I wore hearing aids. Okay, well that makes sense because you're sticking something in the ear where your ear cannot breathe like it used to. So take the time and get your ears looked at consistently. The gadgets and all these different things that go on there, olive oil, and what basically the instructions for that I give patients is 5 minutes, 5 drops in each ear. Okay, let that sit in there for 5 minutes. Lay on your side and then do this at nighttime. Put a cotton ball in one ear, flip over and do the other side for 5 minutes, 5 drops, and leave it in there. And the next morning you can flush it out. Now, remember, as I say, a disclaimer on this is that if you've had a history of ear infections or perforations or any medical issues with your ears, I wouldn't do this. And if that's the case, then I would go see an ear, nose, and throat doctor or an audiologist that's trained in doing this. So I hope that answers your questions. And as I said, the purpose of Coffee and Audiology is to really take our time to think about the coffee in general, and just, on a cold winter day of warming our hands up and enjoying the coffee and just being able to experience different types of flavors and things like that. Coffee is a lot like audiology and hearing, because what we look at, we have all different varieties of people out there that have all different varieties of problems. Even though there's a lot of different types of coffee, we really focus in on the things that we really enjoy. I really love the medical aspect of helping people understand what is really going on with the way the hearing loss is based upon the type of issues that you're having, and really diving in and understanding. So again, as I say, please, I just encourage you, don't give up hope and ask questions, because at the end of the day, the only way you learn, and the purpose of the show is to educate people, the only way you learn is to ask questions. So please use me as even if it's a second resource or as another opinion to be able to ask questions. Please remember that I am here for you, and I thank you so much for joining me today. I hope you have a great rest of your day, and I look forward to seeing you next time. Until then, cheers.